Hi, my name is Reed Hoffman, and I'll be the first of Group 4 to present today on simulation use in nursing education and nursing employment. First, I'll start on the background of simulation use. Simulation use in education and employment training has a broad history that started close to when Florence Nightingale was practicing in the 1800s with jointed skeletons and started to pick up a lot of steam at the turn of the 20th century. Miss Chase was one of the earliest full body mannequins created and was created for training and simulations in 1910 by Martha Chase, who was a doll maker at the time. Full simulations started in the mid 1930s at Indiana University, which used mannequins to train up and coming nurses in how to give injections. In 1970, the first collaborative meeting of experts in simulation data and sharing that data happened and was the start of the first association of nursing simulators. In the 1990s, the use of human patient simulators, the simulators that we are used to, mannequins that interact and talk like a person, started to be in use. And the first one was called Sim1. Uh, it's important to understand that simulations are a technique rather than just a technology, and that they provide realistic practice to students and employees. The foundation of simulators is experiential learning, which is why it's been so successful. It's widely used and accepted, especially in the past 2 decades. Simulations give nursing students a chance to think like and practice like uh, active registered nurses, which is obviously very important. In the uses today, I'll talk about how simulations are used in multiple areas, including nursing and healthcare, like we're used to, and ranging to aviation and business. Now, the video below is not wanting to work for me, but if you look at the PowerPoint that I posted, you can see uh, a simulation to help business students learn how to trade stocks on a floor and kind of give them that experience. In nursing, however, simulations are used extensively in education. Um, we've obviously seen this ourselves, not only in this program, but I'm sure in our bachelor's programs as well. In 2004, simulations were in the developmental phase. And then a survey in 2010 showed that 87% of nursing schools use simulations in their education. And that was 10 years ago. So progress has undoubtedly continued in progress has undoubtedly continued, and their use has evolved. The progression and evolution of simulations are still not complete even today. Nowadays, instead of the educational mantra, do one, see one, teach one, with the introduction of simulations, it's changed slightly to see one, practice many, do one, and is used again, especially in schools and areas where simulations are in use. While simulations are used in training of practicing nurses, it is significantly less widespread in training of current RNs and practicing RNs in the workforce. My personal employer doesn't really use simulations, and I'd be interested to hear from some of you who may use them at your jobs. Simulations use many different training modalities, including anatomical models, task trainers, role-playing, games, computer-assisted instructions, standardized patients, virtual reality, and both low and high fidelity simulators. It is, again, very important to realize that simulations today do more than just train in nursing skills, but also in nursing communication, which is critical to nursing practice.
Simulation use in education and employment training requires key components: few of those key components are the capability of demonstrating abstract concepts, the availability of immediate feedback, and the addition of multimedia into the training environment. Abstract concepts are simulation tools that can transform into interactive visual content, making it easier for students to understand the performance and relationship between the different system parts. They can become familiar with the equipment and the environment and practice the necessary skills without risking accidents to themselves, the equipment, and the environment. The next component, which is the availability of immediate feedback, allows simulation tools to track students' progress and provide standardized feedback that can aid in developing the student or trainee skills. These simulation tools offer targeted skill development, and the student can choose, or trainee can choose, which skill they would like to improve upon and utilize a specific training resource modeled by the educator. The next component, which is the addition of multimedia into the training environment, include text, audio, images, animation, videos, and virtual reality. These components make the simulation tool more immersive. These simulation components also give immediate feedback and are incredibly effective in helping the students understand the content and improve their performance, as they can immediately learn from their mistakes. These simulations should also meet a specific quality standards. All simulations-based experiences require purposeful and systematic, yet flexible and cyclical planning. To achieve expected outcomes, the design and development of simulations should consider the criteria that facilitate the effectiveness of the simulation-based experience. Within these quality standards, simulation use in education and employment and training must meet specific standards for quality according to the International Nurse Association for Clinical Simulation and Learning. The first quality standard is perform a need assessment to provide the foundational evidence of the need for a well-designed simulation-based experience, construct measurable objectives, structure the format of a simulation based on the purpose theory and the modality for the simulation-based experience. The next quality standards include design a scenario or case to provide the context for the simulation-based experience, use various types of fidelity to create the required perception of realism, and maintain a facilitative approach that is participant-centered and driven by the objectives, participants' knowledge, or level of experience in the expected outcomes. Some of the other quality standards includes begin the simulation-based experiences with a pre-briefing. You also want to follow the simulation-based experience with a debriefing and/or feedback session. You want to include an evaluation for the participants, the facilitators, the simulation-based experience, the facility, and the support team. You would want to provide preparation materials and resources to promote participants' ability to meet identified objectives and for them to achieve the expected outcomes of the simulation-based experience. A pilot test simulation should also be utilized before the trainee or student experiences the full implementation of the simulation. If these quality standards are not followed, there are potential consequences that include ineffective assessment of participants and the inability of participants to meet identified objectives or achieved outcomes. In addition, not following these standards can result in suboptimal or inefficient utilization of resources when designing simulation activities.
Social issues often arise from improper use for the lack of reliability or quality of information being put out there. It's important to remember that simulations, they enhance learning environments. So when you're creating simulations or when simulations are being created, there should be a level of factual, actual information that's put out there so that it can be viewed as trusted, so that it can be viewed as creating better outcomes for patient and also increasing patient safety, excuse me. On a legal aspect of it, you want to get approval for or approval of use, and you want to get agreements and also maybe have some letters of confidentiality signed. And that's, in the event there's a use or there's use of actual patients, you want to protect their identity. And then also if, staff members or, other people are being involved in the simulations, you want to make sure that there is a letter of agreement that they have signs saying that they definitely approve to be a part of the process. Lastly, the future of simulation and education. So as it stands, simulation is mostly used in a professional learning environment where an individual learns or enhances a particular skill in a lab. The future of simulation suggests trending towards the use of simulation and assessments in the emergency departments and surgical units. There'll be mobile simulations that will be more accessible in outpatient settings and even on different hospital units. There was talk about also simulation centers. So if people want to get away from where they work and they just want to concentrate on actual simulation, there'll be centers that's available for people to go as individuals or groups like multiple disciplinary teams. Lastly, simulations will be more evidence-based. And I like this idea because it is holding simulations accountable for the information that they put out there. I think it's important to remember, especially in healthcare, that when we are using anything that's a tool to enhance the quality of health being delivered, anything that is to create or simulate a real or an ideal situation, that all of the information is valid and there's no doubt about questioning it. So with simulations moving towards evidence-based practice, that means there'll be rigorous evaluation. So of course, if you take a part of the simulation, after you're done with it, you want to evaluate it and take a look at where there may be rooms for improvement. So it's good to also set standards and expectations. So if there's any dilemmas or if there are any questions that arise, you're able to make it a discussion.